Hi, my name is Kelby Smith. I'm with His Advocates. I'm excited to give you an easy personal choice that could make a major change for the better in your life. Imagine paying yourself hundreds, if not even thousands of dollars per month just by making a simple change in how you approach your health coverage. I'm about to show you how you can make a difference not only in your wallet, but in the way that you impact society. Have you ever thought about where your money really goes when you're paying for health insurance? Did you know that major health insurance providers are funding procedures like gender reassignment surgeries for minors, often without parental consent, and support and pay for abortions as well? These are causes you may have never chose to stand behind, but every dollar you spend with them is a vote for those very practices. It's time to redirect your dollars towards something that aligns with your values and can truly make a difference. By switching to private health coverage, you're not only gaining a better protection for your family's health, but you're becoming a part of a movement that is taking back control. This isn't just any health coverage. It is a nonprofit health sharing program powered by cutting edge technology that could save you up to 70% on what you're currently paying. And it's gaining momentum fast. People all over the country are standing with His advocates and making the shift to a solution that serves their needs while standing for what they believe in. Don't just take my word for it. Watch this short video from somebody who's already made the switch. You'll see how this program works and hear firsthand how it made real differences in their life. By the end, you'll understand your options and why now is the time to make this change. Watch and be prepared to be inspired.
So
Thank
I
you.
just want to give a huge uh, thank you and appreciation on behalf of every single person, every 172 people on this call. This happens every week, and they do a tremendous job with it, and their level of commitment is just unmatched. So I'm incredibly grateful. I actually took a look at Impact when we just launched it. I worked in corporate for 23 years of my life. I was vice president for a major bank. I was vice president at American Express when I finished my corporate career, and I actually went on with full time in this business about 8 years ago. And when that happened, that transition happened, I had never understood, because I worked corporate all my life, the true pain of healthcare for 1099s, for business owners, even for the employees that are working for a smaller business owner. And so the people that are generating income in the United States, I really never understood, because big corporates will negotiate these great plans for us. Yes, we pay out of pocket, but they're so great and that you don't realize. So when I left banking to go full time with the business, my biggest sticker shock was healthcare. We went to pay one of the main insurance companies $2,700 for my family of four. Our deductibles were $6,000 per family member, which means that unless I, had a major catastrophe with my whole entire family, which God forbid, I was never going to use something that I was paying almost $3,000 out of pocket every single month. But you have it just in case of that major catastrophe, right? So we still bit the bullet and did it. And I tell you, I had an appendectomy done with them, and I went into an in-network hospital, and when I came out with that $50,000 bill. How's possible when my deductible was 6,000 for this major insurance company? Came to find out the anesthesiologies and nurses teams and everybody else, we're out of network. How am I supposed to know who works for who? So that's a reality that a lot of people are out there today. This is the reality that America is living in today. And so when we launched the partnership with Impact Health Sharing, my $2,700 bill went to a $628 bill. My 6,000 per member deductible went down to a 2,500 PRA, primary responsibility amount, for the four of us. So we went on to save a little bit over $2,000 a month. Now, I don't care if I know you and you're my best friend, or if I just met you. If you tell me I have the ability to save $2,000 a month, $24,000 a year, and bring it back into my family's income, I'm going to take a look at it, because it's $24,000 a year. We were able to have this blessing to reroute that money. It was just when our kids were starting school, a private school, and it was beautiful that we could reroute that money back into private school. But like many of you on the call today, I was a little skeptical. I was a little skeptical because I thought, how could this be so much cheaper and be just as good or even better if everything they're saying is exactly the way it is? And then I thought to myself, I don't know when I'm going to test this. And unfortunately, I had 3 major instances in my life where I tested this. Immediately, 2 months after we enrolled in Impact Health Sharing, somebody said on Reel online, don't believe everything you see online, that apricot kernels were good for omega-3s. Well, nothing in the package said don't eat more than 8 kernels. I ate a whole entire cupful. I poisoned myself. It releases cyanide. I ended up in the hospital for 48 hours. And so that was my very first experience. This is what happened. I grabbed my little impact card and my husband flew me to the hospital. We didn't even have time to call an ambulance. I was fading. And we just gave this at the door. They grabbed it at the door. In the back, it said EDI payer ID. I paid $150 at the emergency room. And that was it. I went right in. My $16,000 hospital bill after almost 48 hours of being in the hospital was repriced. And I'm using my husband's computer, so I don't have it with me, Jeff, but it was repriced at $1,500. So I had a $16,000 bill that went down to $1,500, and I paid the $1,500 plus $150 at the door. Had I gone with my traditional health insurance, it would have been $400 at the door because that was their provider fee. That was experience number 1. January of that year, for those of you that say, oh, I'm healthy, I don't need health insurance, okay? I was at the gym because I'm healthy, and I had a 15-pound kettlebell in my hand and no shoes, dropped the kettlebell right on top of my shoe, broke my foot. What it should have healed in 6 weeks ended up healing in 10 months. So for those of you that know me, you've seen me, I run around with a boot. I did everything you can imagine. I did bone density scans, I did MRIs, I went to every doctor I could. And when I was at my wit's end, my foot wasn't healing, I decided to go and get a second opinion. I live in Dallas. My father said, I bet you the best doctor in Dallas is the Dallas Cowboys doctor. And I said, you know what? I bet you too. So I went to see him. Not only he was the foot doctor of the foot orthopedist for the Dallas Cowboys, he was also for the FC Dallas team. So I saw the best doctor in all of Dallas. Why? Because I don't have a network. I could go get an opinion wherever I wanted to go get an opinion. At week number 7, my orthopedist says, Alejandra, you are not healing. You need what's called a bone growth stimulator, but we have to wait until week 12 because insurance has this stipulation that you're not considering a non-union until week 12, even though I can tell you right now, there's absolutely no growth in your bone. There's no movement. You already, I know you're the typical non-union case. You need a bone growth stimulator. We have to sit tight for 12 weeks. Can you imagine? I said, well, gladly for me, blessed for me, I don't have health insurance. I have this little impact health sharing thing. Do you mind like putting it through, see what happens? By the end of that same week, I had the bone growth stimulator at my house. Guess how much I paid? $0. I had already reached my deductible. I had already reached my co-share, and I paid $0. Then this year, my son broke his elbow. At a bouncy house, 7 years old, fell off the bouncy house. Moms, you probably understand if you have boys, you are going to deal with broken bones. When he broke his elbow, I didn't have to go into a computer and say, hey, where, out of all these people this orthopedist, which one is the best one in the Dallas market? No, I put a message to all the Liberty Christian parents. Where is the best? Who is the best orthopedist? And everybody said, Scottish Rite is the best hospitals, number 4 in the nation. It's for orthopedists, just for children. It's a hospital just for orthopedists. Guess what I did? Packed them in the car. Off we went to Scottish Rite. This is what happened at the door. I'm gonna tell you the honest truth. Lady goes like, oh, you're out of network. I'm like, I don't have a network. Oh, no, but you're out of network. Look, see, here's the kicker. They won't understand what you have in front of you. So I said, it's okay. In the back, there's an EDI payer ID. Do you mind running it through? He said, sure, run it through. Maybe you have some out-of-network benefits. I'm like, sure. Just run it through. Went through, no problem. My son went to the best orthopedist in town for his elbow. 5 weeks later, we were out of that into our next thing. Guys, what I'm trying to share with you today is the blessing that you have here. The blessing that you have here. It's something that you can't keep for yourself. See, when I think about my God, I can't keep it to myself. I talk with everybody about the beautiful things that the Lord has made for me. You know why? Because I can't hold it in. But you know what I also share with everybody? That this exists. Because the ones that are not using it and need it, they don't use it because they don't know. Even those employers that allow employees, mid-sized employers that allow their employees to pay for their own health care, a lot of them, they have a great percentage of 20, 40% that opt out. Why? Because they can't afford the part they have to pay for. You have a blessing. When you have a blessing, you have an obligation to go share. So I'm going to just invite all of you to make sure that in a daily basis, you reach out to at least 5 people to share about the blessing that you have in your hands. It's been a blessing for my family. I pray I don't have to use it that much anymore. But Jeff, thank you for letting me share with you.
All right. Now you understand why it's so important to get your keys to that Ferrari program like Impact Health. Whoever invited you to watch this video, go back to them, use their link and sign up today. If you came directly to my site or you went to our YouTube channel directly and nobody asked you to come and watch this video, do me a favor and sign up at the link below. But otherwise, go back to the person that showed you this video. We want to thank you for the opportunity to serve you and help you vote with your dollars. This is going to make the change that America needs, and it's going to help you save the money you need. It is getting so expensive to live in this nation. It's finally wonderful to see where somebody actually is trying to help people. And it's through this direct marketing concept that allows for the reduced coverage. It's the technology that allows for the reduced coverage that squashes those big bills down to nothing. It's an amazing, amazing opportunity. So again, if you came straight here and I invited you, use healthintheprivate.org to sign up. If it was somebody else, please, please, please use their link and go back to them immediately. God bless you guys. Have a great day.